Are you still dealing with groin pain that won't go away? The test in this video will show you things your MRI won't. This is an updated version of an earlier video that we did. I'm going to clarify things for you along the way.
So groin pain is pain in the hip crease here in the front of the hip. A lot of times what people complain of is pinchy, achy, stiff, sometimes sharp and shooting.
Putting on shoes. Washing feet.
Squatting.
Stairs.
Sitting. I thought we were going to keep going back and forth.
Getting out of a car. Ooh, bringing the hip up,
yes.
like in dance.
Yes, absolutely.
We'll kind of teach a self-test here, but again, it is always best to cluster test. Let's bring this knee to your chest. Grab it with your hands. Pull in really slowly. Does that bother your hip flexor?
A little bit.
A little bit. This is not your hip flexor. And here's the reason why. It's because her hands are doing what the hip flexor's job is, part of one of its jobs, which is pulling, is flexing the hip. Now, let's go ahead and keep that there, but remove the hands. And so this might still hurt.
No, it actually went away.
No, it went away.
But if it did.
So if it did still hurt, yeah, maybe still that is the hip flexor. But we know that if the hip flexor is off and her hip is already into a flex position, it's probably not the hip flexor. And we can double down on this a little bit more and go ahead and give me a little bit of a crunch and hands right there and push. Don't let it lose. Don't let it look good. And relax. And so now we've loaded the hip flexor. Does that hurt? If it doesn't hurt, it's not a hip flexor. And we're looking at probably the next diagnosis, which is going to be hip impingement, or it's going to be something else. But
now, if that test was positive, we're dealing with hip impingement or overactivity of the hip flexor. Regardless, centration of the joint here is really important. I'll show you on the model now. If you're not sure what to do next, reach out to us. We have telehealth options. We're licensed in different states and we can help you. This is our handy dandy hip model, and so this is the joint where it needs to seed well into the actual socket of the hip. For those of you with overactivity of the hip flexor in the front here, it pulls it forward, not centrated well, but also compensating for some of the underactivity of the gluteal muscles, which is really commonplace. People with hip impingement, it's usually chronically jammed into the front, which is what creates the pinch point. Stay tuned for the next test as we can learn about the possibility of referred pain from either the spine or local nerve structures over the hip.
Referred pain in this instance is, although you're feeling pain in one specific area, like the groin or the front of the hip, does not mean that there's a structure in that specific area that could be causing that pain. One of the main things that we use to kind of elaborate on what referred pain is a heart attack. The chest is the source, the heart is the source of pain. Sometimes people feel pain into their left arm. If we only look at the left arm, then we're gonna miss what the real true source is. So when it comes to the groin pain itself, there is nerves that feed into that area as well that come from your low back. And so when your low back is a source of pain or you're getting irritation in that specific area, you can have it felt in the front of the groin there.
And so there's various tests we can do for this, but there's a simple one, skin rolling. It's surprising when it works. And so all we're gonna do is just kind of grab, there's a crest right here, so you'll hand on hip slide down, you'll find a bony area. Grab a big chunk of skin right around the area, and this always sounds ridiculous, but do hula hoops, big hula hoops, big hula hoops. Do about 5 or so. Yeah, there you go. Don's doing like the sassy teapot. Kind of make your way out to, we can go out here, same thing, hula hoops. And you get into here and you kind of grab the skin around the thigh and you go wiggle, 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 wiggle all the way down. And you kind of just follow this path right down here. After that, you test your movement again, and then all of a sudden, if it's halfway better, this is a really good sign. There was a girl the other day, she had 9 years of hip pain, and this reduced it by more than half within just a couple minutes. Again, it won't stick. You have to go further. This is just step 1 in the process.
If the last test was positive, it means it was possibly referred from the spine or local nerve structures. Regardless, typically strength and conditioning, structure rehabilitation, and making sure you have good manual therapy is usually a good starting point for care with this. I placed a video in the corner which helps understand a little bit better about referred spine pain to the hip. We also have a free hip webinar which covers a lot of these details, also in the description. Remember, if you'd like some help, we have telehealth options. Look in the description below the video. All of our contact is there.